Okay. Look who I'm with.
Hi.
It's Megan. She's here, guys. She's going to tell you a little bit about her background, where she's been, and what she does here at the center. I'm going to give her this camera. It's a little bit of a vlog style.
Awesome. Hi, everybody. I'm Megan. I'm a psychotherapist here at the Center for Therapeutic Services. I've been a therapist here since 2020, and prior to that, I internshiped here as well. So actually, to be honest, I've been here a little bit longer than 2020, but officially a therapist since 2020. I've always wanted known I wanted to help people, and one of the biggest ways that we connect with each other is through communication. Whether it's in my sessions with my clients, or in a group setting at a family gathering, or even through my latest outlet of podcasting, discussion is important to me. So before I started my master's, I worked on an inpatient unit for adult behavioral health. There was an array of mental health struggles that I worked with, schizophrenia, depression, anxiety, and even some personality disorders. So I ran groups on the inpatient unit that I worked in, which was one of my favorite parts of my job. And at the center, I work with adults who struggle with anxiety, depression, adults with ADHD, and even some younger people, such as teens and people in their 20s.
Okay, I'm recording. Okay, so we're in a little different position here, but let's move on to the therapeutic approach. This is one of my favorite things to talk about with the clinicians because it is so important to differentiate between the different... No, that's not okay. So let's move on to the therapeutic approach. This is one of my favorite things to film with the clinicians, but it's really the hardest because we're taking these really big, dense topics and shrinking them down to little mini potential precursors, if you will, to things that are available here at the center as well as just in the mental health field. And I truly believe that by providing insight and clarity around the different approaches, techniques, and skills available, that the public, clients, viewers can really have a better understanding of how to effectively navigate mental health services. And you know, we can't speak to how every clinician practices or how every session will go. It's really a journey in finding what works for you. And so we can provide snapshots into the different options available. So before I get on my soapbox, let me switch over gears to allow Megan to kind of speak to her approach and a service that she offers here at the center.
Awesome. So really quick before I get into some of the details, this is a really unique treatment compared to like regular talk therapy. This is, there's a specific protocol for it, and we're actually using measuring devices such as like the electrodes and temperature gauge and other things to measure our responses. And I think that's pretty cool, and it's just different from the regular talk therapy. So biofeedback utilizes body responses to stress, so like heart rate and skin temperature, brain waves, etc. And there's so many things that we already got, right? We talked about our systems that we're naturally born with, and so we can utilize them this way. Biofeedback uses these responses and measures these responses through electrodes, thermometer, and heart rate, like I had said before. So with that data, we can learn what is going on for the client and how they're responding, and how we can use that data to help them function more effectively in life when they're stressed out. And the really cool part that I love is that it's really great for adults and children. It's not invasive, which is really cool, and it's all natural. We're using our natural responses. The biggest elements that it helps with is headaches, irritable bowel syndrome, anxiety and panic reactions. It helps also with chronic pain, incontinence, stress-related infertility, and also sports performance. It really depends on the client in terms of what kind of treatment length. And so typically we're looking at about at least 10 sessions of treatment before people start to gain the benefits from it. And it could take more or less. It just really depends on how the client is responding.
Okay. Capiche?
Yes!
She did it! So I do have to interject here. We are currently
not providing biofeedback at the center. Megan is fully certified and able to speak to this offering as an intervention, but we are in the midst of finding the right equipment and machines to provide that. There is a lot that goes into that offering. So once we are able to, we can create a new video with the machine and equipment set up for you guys. But right now, this is just an informational snapshot of what we do have and do know based on Megan's certification. So with that, I hope you guys head over to the next video of Megan doing a deep breathing demonstration. I loved filming this video with her, and it was so relaxing in the moment to take those 10 counts and to breathe deeply, and just how she works to integrate that into her approach. As well as with biofeedback, right? It's giving you an in-the-moment intervention to utilize in those times of high intense stress. So I hope that you guys like this video. I hope that it provides some information and a capture of what biofeedback is all about. And we will create content around that offering when we can offer it at the center, but some information is better than none in my opinion. So as always, take care of yourselves, and I hope we catch you in the next video.